The focus of my research is on perinatal mental health, so that's mental health during pregnancy and early years, which is mainly the sort of first 12 months after a baby's born, but also extending up to sort of 3 to 5 years after the birth. So my particular interest is in the context of existing adversity, particularly where one or other parent has an existing mental health difficulty, and how focusing on pregnancy and the early sort of postnatal period can give us a window into potential psychological vulnerability or risk factors, but also resilience factors. My goal from doing these type of projects is to help understand what these particular risk factors are, but then use that to inform healthcare planning and policy, and of course how we develop psychological interventions for families in the perinatal period to give both parents and children the sort of best chance of reaching their developmental potential. So one of the things that I'm particularly proud of in terms of recent projects is we've been working with colleagues in Glasgow, but also in Denmark at the University of Copenhagen and the University of Southern Denmark, developing a cohort of mothers with existing complex mental health difficulties, so schizophrenia, psychosis, bipolar disorder and depression. And we've been recruiting these mothers during pregnancy and working with them over pregnancy and up to the first 12 months after the baby's born, looking at a number of factors, particularly how their understanding during pregnancy of their relationship with their child develops in pregnancy and then postnatally, and how that then impacts on mother-infant interaction. And what we're finding is that how you think you are going to be as a parent has a quite strong impact on how you then parent your child, even at sort of 4 months after birth. So that's giving us some fascinating insights into how the sort of psychology of parenthood develops in the context of an existing mental health difficulty, but also gives us some really useful indicators for developing psychologically informed interventions for parents, particularly in these more complex risk situations. The exciting thing about working with pregnancy and perinatal and early years is it's potentially got global impact in terms of the UN Sustainable Development Goals and the renewed focus on the psychology of women and families and the well-being of women and families. So locally, we know that there's been a number of commitments by both the Scottish Government and the UK Government to developing perinatal mental health services. So the research I do hopefully directly informs how we configure mental health services to fit the needs of families, particularly in situations of increased vulnerability. We also know from projects that we're developing in the global south, in Malawi and in India, that there's huge potential to combine perinatal and maternal mental health into existing maternal health care and potentially bring mental health to the fore for a much larger segment of the population globally. So in terms of PhD projects that I'd be interested in supervising, I have relatively broad interests, so projects involving pregnancy, maternity, parenting, including fathers, and how that might impact on child development, but also mental health. So in terms of methodologies, I'm interested in data science, data linkage projects, sort of psychological intervention and mechanism development, and potentially qualitative projects also.